My name is Jillian Parker, and today I'm at Rochester Regional Health's Henrietta Medical Campus. While many folks at home are utilizing telemedicine, the team at Rochester Regional Health has been working on a plan to keep you healthy and safe if and when you should need to see one of our healthcare professionals in person. Things may look a bit different the next time you walk in, so I'm here today to show you what to expect the next time you visit one of our facilities. Don't worry, all patients will receive a phone call before their appointment to walk them through that process, but your first task is to put on your mask. So we're gonna head inside to see what else you should look for during your next visit. I am playing the part of a patient walking in for the first time to see what changes have been made since COVID-19. They have an X on the floor here. Good morning. And now the X on the floor, is that the only form of check-in right now? I know we're maintaining 6 feet. Is that what the X is for?
Yes. The X is to keep us 6 feet apart for social distancing. We also offer the option of kiosk check-in. We do keep those clean. We wipe them down before and after patient.
And before I even check in, what methods are taken prior to that as far as the screening process?
Yep, so yesterday you should have received a call from one of our staff members confirming that you have not been around anybody COVID positive, to be sure that you don't have a fever, you don't have any symptoms to go along with COVID. And from there, we asked you to make sure you wear a mask to your appointment today, and you do not bring a visitor with you unless it's absolutely necessary.
Good morning, Jillian.
Good
My name is Jim. I'm the medical assistant for Dr. Wagner. Welcome to Henrietta.
Thank you.
I'll ask you to come back with me to the exam room.
Okay. You can see no one is waiting in the waiting room.
What brings you in to see Dr. Wagner today?
I have some swelling in my ankle.
Okay. Have you ever seen Dr. Wagner before?
I have not. It's my first time.
Well, my job as a medical assistant to get you all logged into the office here so the doctor can come in just a couple minutes and go over some things with you. So.
And I see you used hand sanitizer. How frequently have you?
We use hand sanitizer as we enter the room and as well as when we exit the room.
Okay.
And all the tables and chairs and doorknobs are all wiped down with our cavi wipes prior to each patient coming in the room, also when the patient leaves.
Hi, how are you?
Hi, Dr. Wagner. How are you?
Good to see you
Good
again.
to see you too.
So what brings you in today?
I have a little swelling in my ankle.
Before we talk more about that, do you have any concerns about everything going on with COVID?
Well, I noticed that you put on hand sanitizer right when you came in the room. He put it on before he left the room. I guess what is the practice as far as continuously either using soap and washing or using hand sanitizer?
Yeah, we're using soap and washing our hands in between every patient. And then every time we come in and out of the room, I do hand sanitizer as well. If you have any questions throughout the day, I recommend you ask, because a lot of this is very confusing right now for patients, but we're doing everything we can to make it as safe as possible and as comfortable as possible.
It's new for everyone. I can see, as I have a mask on, you have a mask, but you also have a face shield on. What is it that you're practicing here as far as having both of those on?
Yeah, currently our precautions, we're being extra safe and we're wearing both the mask and the face shield. As extra precautions, just to keep everyone involved as safe as possible.
And when I walked in, I noticed that there was no one in the waiting room, which is not a sight you often see.
Yeah.
Will there be no use of the waiting room right now?
Right. For now, you'll check in and wait in your car, and then we'll bring you in. Other than that, we want the visit to be as close to it as normal as possible. And we think other than the waiting room and the facial protection that we're wearing, it really is. And we're using different patient slots than we normally would to keep things spread out. And it's actually running in a very timely manner, and we're running on time, which is nice.
And as I'm here as a patient for the first time, I can see the changes that have been taken. What would you want, a message that you would want to send everyone at home about these safety measures? You've been touching on them, but why should they feel safe coming to the doctor's office?
I think feel safe because we're taking the necessary precautions. We want people who have medical problems that need to be addressed other than COVID to still be able to come and see us so we can help you out. Just be patient with us, and we'll be patient with you as we all work together to try and do it in the most controlled manner we can.
Okay. Thank you very much.
No problem.
And remember, everyone, the team at Rochester Regional Health is really working around the clock to make sure these facilities are safe for you, the patient, the next time that you arrive. Healthcare never stops. If you have any additional questions or concerns, call your healthcare provider today.